It will give me peace of mind, yes. I don't have to worry about getting in an accident and bleeding to death either.
At this point now, she's got a very low risk of stroke because the Watchman has sealed off the left atrial appendage, and she doesn't have to deal with the lifelong risk of bleeding from her blood thinners. There's a real good seal there, no signs of any blood clots, and we can stop the warfarin now for good. At this point, we'll put you on a baby.
Hallelujah.
For many patients, the hardest part about living with atrial fibrillation is dealing with the blood thinners that are used to try to lower their risk of stroke. It ends up costing lots of time, energy, and effort coming back and forth to doctor's office for routine checks and adjustments of the medications. And for many people, even when they're trying the very best they can, we can never get it where it needs to be. Fortunately, we have an alternative to blood thinners for patients with atrial fibrillation. There's a new device called the Watchman left atrial appendage occlusion system. What this is a plug that helps us seal off the left atrial appendage, essentially closing off the area where most of the blood clots that cause stroke form. Some patients have a higher risk of stroke than others, and there are certain risk factors like heart failure, diabetes, prior strokes, coronary disease, age. As you add more and more of those risk factors, your risk of stroke goes up. Once you have more than 2 or 3 of those risk factors, you really should be on blood thinners. And if you can't tolerate blood thinners, this Watchman is the best alternative.
I have had a diverticulitis, and I can't be on thinners, blood thinners. The only blood thinner I can take is a baby aspirin.